Hi, I'm Dr. Cordelle Ofori. I'm a public health doctor, so I'm a consultant in public health medicine based in Manchester. Over the past 18 to 20 months, most of my time has been spent working with both the NHS and Manchester City Council, local government, responding to the COVID-19 pandemic. Today I'm going to be watching a debate that Pi Radio did about the COVID-19 vaccine and commenting on it from my professional perspective, and also giving some confirmation on the facts about the vaccine.
A lot of people assume that because they're young that they're going to be safe, or that there's going to be lower kind of like consequences for not getting the vaccine. But actually, if you look at recent hospitalization and recent cases and like fatalities and stuff like that, it's actually young people that are now disproportionately being affected, because when the vaccine rollout first was mandated by the government, obviously they're focused on the elderly and the more vulnerable, and the young people are now the demographic that are least vaccinated, and they are now the most affected.
There was a peer review done in the UK on deaths in children and young people in England, and they looked at over 470,000 children, and only 60 of those passed away with COVID. Of those 60, 25 of them had other comorbidities, and only 6 had no underlying health issues. So if only 6 people have died at a young age, then they definitely don't need a treatment.
As a young person, if you get COVID-19, the chances of you getting it badly and the chances of you dying are much lower than if you were an older person. And the younger you are, the less likely you are to get it seriously, and the much less likely you are to die. That is all very true.
And the scientists have figured out that the actual statistic for anyone under 18 from dying is 99.995% survival rate. So to me, that again you don't need any treatment for that.
However, young people can get long COVID. So we know of teenagers now who are having to have lots of time out of school. They can't mix with their friends. They can't live a normal life because they've got this horrible condition that just stops you from living life normally. They get brain fog, they're exhausted all the time, they can't think straight, you can get body aches, coughing going on, breathing problems. It's really not a nice illness.
And you are more likely to die from being struck by lightning than you are from COVID. Total chance of dying, no matter what age you are, is 0.05%. So to me, that's nothing to fear, and there is no pandemic.
A pandemic, by definition, is a new disease, a new infectious disease that's spreading from person to person around the world. That is definitely happening with COVID-19. We know now that worldwide there have been over 240 million cases of COVID, and really sadly more than 5 million people across the world have died now. So it's very, very real. I personally know doctors in hospital who've had to look after people with COVID, and how they've described just what a horrible illness it is when you get it badly. I also know people who have died. And I also know people who've got long COVID.
There's no long-term data to know if it affects women's fertility. We don't know how long. There's nothing to be able to say to a young child, you could get a cold and you could get a cough, but don't worry about that. You could kill your grandma, so we'll just take a risk that we could make you sterile.
Getting COVID can just cause general disruption to life in lots of different ways. So young people can still pass it on to other people, to their families or older friends, people who, if they got it, would be more likely to get it badly and would be more likely to die. And also, if you get it, there's knock-on effects in terms of people having to self-isolate, take time out of school or college or work. It's really, really disruptive. And the sooner we really get a grip on it, the sooner that all of our lives can get back to normal. So even though as a young person, the chances of you personally getting COVID really badly or dying from it are low, the reason why the vaccine is so important is partly because, it's not a nice to have it in the first place. Even if you don't get it badly, you want to stop it passing it on to other people, and also just that general disruption to your life and that of your family and friends and community that we really want to put a stop to.